New COVID-19 Omicron variant has fueled the fourth wave in the country, with Tshwane being the global epicenter of the variant. That's according to the South African Medical Research Council. Let's discuss this now with the Council's AIDS and TB Research Director, Dr. Farid Abdullah, who is also part-time HIV clinician at the Steve Biko Academic Hospital. Dr. Abdullah, thank you very much for your time this evening. Let's start off with unpacking why you think Tshwane is the global epicenter and, in fact, the epicenter here in South Africa.
Lee, thanks for having me. The first documented cases of the Omicron variant are from Tshwane, and we've seen an exponential rise in the case numbers, which are sort of linked to the same time as the Omicron virus. I think it's common cause now that the new infections in Gauteng are being driven by the Omicron variant, and Tshwane has had the highest number for the last 3 weeks. Just in the last 5 days, we've had almost 10,000 new infections in the Tshwane district.
Are tests that are being conducted testing specifically for Omicron, or is it just sort of at this stage general assumption that those would be driven by the Omicron variant?
So there's a rather fortuitous situation obtaining here, in that the normal PCR test on most of the PCR testing machine can pick up that this virus is different in one region of the viral genome. And so we're able to more easily say that this is Omicron. The same thing happened with the Alpha variant, which we didn't have much of here. But this S gene drop-off shows not all the hospitals have the same machine, but it's been rather easy to pick up that is Omicron just with the normal PCR test. And looking at the lab data behind just the result that you get, which says it's positive.
Given the number of new daily infections, are we at this stage to believe that the Omicron variant is more transmissible, or is it too early at this stage to determine that?
I'm not the expert on this subject, but just from what I've seen, you know, the experts like Professor Shabir Mahdi are pretty clear that there is higher transmissibility. There are enough signs now to show that this is highly transmissible. The best sign is that there have been a few comparisons showing the rapidity with which this variant has spread compared to the previous waves, which were previous variants also. And yeah, I think it's pretty common cause now that this has a higher transmissibility than the previous variants.
Dr. Abdullah, what are we seeing in our hospitals at this stage? You're on the ground dealing with cases, seeing what is happening in terms of hospitalizations, increasing or lack of capacity of beds. At this stage, we're not quite at panic stations yet, but all three of the experts we spoke to on a panel discussion on Omicron a little bit earlier this evening said that certainly there is concern, that we need to take heed, that we need to make sure our medical facilities are prepped and ready for the peak of this fourth wave. Tell us what your observations have been in the last couple of days.
Well, the first thing that is undoubted is that there has been a rather rapid rise in hospital admissions with patients who have COVID. They're testing COVID positive, whether they are presenting with COVID pneumonia or severe COVID disease or other conditions, and are testing, incidentally testing positive for COVID, is something that I'll say a word about just now. But the rise in infections is rapid, especially in the Tshwane area, and I believe now in most of the Johannesburg hospitals and Ekurhuleni Hospital. So it's rapid. I mean, we're seeing, 10 to 20 admissions a day at Steve Biko, but I can tell you that the hospital admission numbers, the bed occupancy numbers for COVID beds at George Mukhari has grown substantially over the last couple of weeks. Jubilee Hospital, Kalafong Hospital, so all of the hospitals in Tshwane, in the public sector, in addition to that, all of the private hospitals are seeing an upsurge. And it's a big increase in hospital cases. And the same is being reported now from Barra, from Helen Joseph, and from Tembisa hospitals. So undoubtedly, there's a rapid rise in hospital admissions, and the COVID bed occupancy is increasing, even kind of increasing 30-40% per day over the last few days.
What kind of preparations are being made in hospitals across Gauteng in terms of increased bed capacity, increased staff capacity, increased capacity in terms of ventilators and equipment?
Yeah, so the main thing we've kind of seen now is that hospitals transition from during when waves start to rise and peak and the COVID admissions increases, then there's a shift from the non-COVID areas to the COVID areas. So there's a shift of resources, beds, staff, equipment, and that's because Gauteng has been through previous waves, and the third wave was a whopper. It was a big one. That shift is starting to happen, and you will think this is the fourth time we're doing this now, so the hospitals are responding in that way. But what I would like to talk about is that we're seeing a very different picture in terms of the profile of the patients, and I'm sure you want to come to that now, but let me jump right in. I did a snapshot on Thursday of 42 patients at Steve Biko Shwane District Hospital, which is one complex. And what struck me is that 76% of the patients in the wards were on room air. They were breathing normally. They didn't have oxygen masks on their faces. And this is quite a big difference from before. So I would say that most of the admissions to COVID wards at the moment are incidental COVID admissions. They are in the hospital for another reason, another very good reason. They're ill from a medical, a surgical condition or an obstetric condition. But the majority are not oxygen dependent and are in the hospital for another reason. There are still a small number of patients, and whether that's rising or not is a little difficult to say, who have the classic COVID pneumonia, but it's rather remarkable. And I've been there in the previous 3 waves, so we've actually seen that there is a difference now. Now, I must immediately say that this could be just an early effect, and that 2 weeks from now, I'll be sitting here saying to you, it's as bad as it was in the previous waves. But for now, there is definitely a difference. And my colleagues in other hospitals are confirming the same picture. So 76% of our patients in the COVID wards at Steve Biko Shwane District are not oxygen dependent. And a similar picture at Helen Joseph, George Bukhari. Those are the hospitals I've talked to.
Certainly some good news. We do thank you for that, Dr. Farid Abdullah from the South African Medical Research Council, giving us some good news about those patients who are currently hospitalized, 76% of them not needing to be oxygenated. Hopefully that holds out as the 4th wave peaks in the coming weeks.
Facing a massive surge in COVID cases, the European Commission chief says that the world is in a race against time to understand the new COVID variant. And here her comments come as most of Europe is reporting a record COVID cases. The new COVID variant has been detected in several EU countries, worsening an already tense situation here.
We take this Omicron variant very serious, and we know that we are now in a race against time. Why that? Because we know not all about this variant, but it is a variant of concern. And the scientists and manufacturers need 2 to 3 weeks to have a full picture about the quality of the mutations of this Omicron variant.
The Netherlands, meanwhile, confirmed that it had detected 13 people who tested positive for the Omicron variant. They were among the 61 people who tested positive for COVID after arriving on the last 2 flights from South Africa before a flight ban was imposed. This comes as the country tightened its COVID restrictions, with the country being essentially shut after 5 p.m. Residents of the country say that they are resigned to their fate just weeks after violent protests broke out against lockdown restrictions and vaccine mandates.
You never know, right? So the whole pandemic learned us that you don't know upfront. And I try to be not too worried until we know more. So
I think it's going to be happening all the time. It's going to mutate, and we have to be prepared for that. After this variant, new variants will come.
Then shifting our focus to France, the country's health minister said that it has detected 8 possible cases of the Omicron variant and that the country will maintain a ban on flights from southern Africa at least till Tuesday. And France is in the middle of the 5th wave of the pandemic. It has recorded over 31,600 positive cases on Sunday, has seen a spike in patients in the ICU. More than 75% of France's population is fully vaccinated. Nearly 7 million people have had their booster shots as well.
Dès qu'il y a un cas suspect, nous isolons la personne et nous procédons à des tests poussés, c'est-à-dire un séquençage. Nous regardons le profil génétique du variant et du virus. À date, il n'y a pas encore eu d'identification de ce type de variant Omicron sur le territoire national, mais c'est une question d'heures, très probablement, il faut se dire les choses. Il circule déjà en Belgique, il a été identifié en Italie, il a été identifié en Allemagne. Je voyais qu'il était identifié également en Australie.
In Germany, calls for tighter restrictions are rising as fears about the new variant rose. 2 Omicron cases have been detected in the country so far. Restrictions on air travel from South Africa also took effect on Sunday, meaning that airlines can fly only Germans to Germany from South Africa, and even those who are vaccinated must spend 14 days in quarantine. Germany is currently struggling to contain a 4th wave of the pandemic. It reported over 44,000 new cases on Sunday. Over 100,000 people have died due to COVID since the start of the pandemic. In Austria, over 5,000 people took to the streets on the weekend to protest against the compulsory coronavirus vaccinations. Austria is one of the lowest vaccination rates in Western Europe. Only about 66% of its 8.9 million population have gotten a jab. Austria has a very vocal minority who refuse to be inoculated. The protests come after Austria pledged to be the first European country to mandate vaccines beginning from the 1st of February. Meanwhile, across the English Channel, Britain said that it will convene an urgent meeting of G7 health ministers today to discuss developments on the new Omicron coronavirus variant. The British government announced new measures over the weekend to try to slow the spread of the new COVID-19 variant, toughening rules for people arriving in Britain and ordering mandatory use of masks in public. Some school children will also be required to wear face coverings in communal areas.
For security reasons, baggage left unattended will be removed.
WION is now available in your country. Download the app now. Get all the news on the move.
Omicron variant poses a 3-fold higher risk of reinfection than the Delta variant. That's according to a study conducted by the South African Center for Epidemiological Modeling and Analysis, as well as the National Institute of Communicable Diseases. The NICD added, this could be the reason behind the recent increase in COVID reinfections in South Africa. It explains the Omicron variant was able to evade immunity and is rapidly becoming the dominant variant in the country. India reports its first 2 cases of the Omicron COVID-19 variant. India's health ministry says the 2 male patients showed mild symptoms but declined to provide their vaccine or travel history, citing their privacy. All of the primary and secondary contacts of both cases have been traced. Local media reports that 5 contacts of one of the men also tested positive for the new variant. India's case count currently stands at 34.6 million, with nearly 470,000 deaths. It suffered a record surge in infections and deaths back in April and May due to the Delta variant. It has since fully vaccinated just 49% of its 944 million adults, despite having ample supplies of domestically made shots. A vaccinated person without any links to risk countries has tested positive for the Omicron variant in Spain, bringing the country's total number of Omicron cases to 5. The patient is a 62-year-old man in Madrid who has shown mild symptoms since the 29th of November and is now under home isolation. According to a report, there are 2 similar cases that are currently being examined by experts. Spain's 14-day coronavirus infection rate rose again to 234 per 100,000 people. That's twice as much the number on November 19. The U.S. lays out a new strategy to fight the Omicron and Delta variants this winter season. In a bid to increase COVID testing, President Joe Biden has required private health insurers to reimburse their customers for the cost of over-the-counter tests and make 50 million more tests available for free. Mask requirements on planes, trains, and public transportation will also be extended until March 18th. Biden announced a shorter COVID testing timeline for inbound travelers as well. The Omicron variant has now spread to 4 states, with New York reporting 5 cases Thursday.
It used to be that international traveler flying to the United States had to test negatively 3 days before their departure from that country. Well, I'm announcing today that all inbound international travelers must test within 1 day of departure, regardless of their vaccination status or nationality. This tighter testing timetable provides an added degree of protection as scientists continue to study the Omicron variant.
Germany, meanwhile, gets tough on the unvaccinated to break a dramatic surge in daily infections that's been exacerbated by the Omicron variant. The government plans to bar unvaccinated individuals from all but the most essential businesses, such as grocery stores, pharmacies, and bakeries. Mandatory vaccinations are also among the measures being discussed. Virologists have blamed the 4th wave on vaccine resistance by a large section of Germany's society. The Philippines' COVID-19 task force releases new testing and quarantine guidelines for international passengers arriving from countries not included on the red list. The fully vaccinated will need to have a negative RT-PCR test conducted within 72 hours prior to departure and undergo a 5-day facility-based quarantine. They will be tested again on the 5th day, while the unvaccinated, partially vaccinated, or those whose vaccination status cannot be independently validated will be tested on the 7th day. Regardless if they get a negative result, they will still be required to quarantine at home for 14 days. Meanwhile, returning Filipinos from red list countries will only be allowed to deplane at the Ninoy Aquino or Clark International airports. The provincial government of Negros Occidental says the returning Filipino and 3 expatriates who recently arrived there from South Africa have tested negative for COVID. South Africa was the first country which reported the Omicron variant. Despite the negative results, the 4 individuals will still finish their quarantine period.
These foreigners from Africa, they have their own house here. They do not, the good thing is they do not hire local people to work for them in their house. They do their cooking, they do their washing, they stay in their own quarters. We have already contained the biomass station or the factory where they are working.
The Philippines on Thursday logged 564 additional COVID cases. This raises the country's total COVID infections to 2,833,000. The health department also recorded 40 more deaths and 694.
A flurry of meetings and action in Bengaluru. India's first 2 Omicron cases emerged here. But not just that. One of them, a 66-year-old foreigner, quietly left the hotel in which he was quarantined and then the country itself after getting a COVID negative certificate from a private lab.
We are already given the complaint. We are instructed to the police commissioner and corporation commissioner also. Investigation must be thoroughly done. What is the mistake in the labs?
Patient number 2 was discharged from hospital some days ago, but went back in as part of the protocol after Omicron was confirmed. Samples from 5 of his contacts who tested positive have been sent for genomic sequencing. Results are expected in a couple of days. And in the latest in a series of clusters in educational institutions, 11 Class 8 students in a school in Kodagu district tested positive out of 53 tested, a positivity rate of over 20%. Students in Class 6 to 10 are being tested too.
First, I would like to speak about
The Health Minister also met medical college heads to talk about getting ready for the third wave.
We have reviewed thoroughly about the preparedness for the third wave, or we could call it as this Omicron's effects, probable effects.
Karnataka has also decided to restrict entry to malls, cinemas and theatres only for the double vaccinated. Gatherings are limited to 500 people. There will be no functions at educational institutions until January the 15th. There will be compulsory testing of health workers and people with comorbidities or those above 65.
Do not go by the anecdotal note that this is just mild. It may change its behavior. So please be very, very cautious. Maintain as much caution as possible at this juncture. When it crosses a critical tipping point is when you will not be able to predict what it can do.
There are some new restrictions. For example, to get into a mall like this, you would need to be doubly vaccinated. But by and large, the city of Bengaluru is as busy and bustling as ever. But with the new variant having been detected and with cases on the rise, that could change if the state government decides that prevention is better than cure. With Govind and Kumar, Maya Sharma in Bengaluru for India.
Omicron. I did not say Emmanuel Macron or Marion. It's Omicron. It is the new COVID-19 variant that is so predominant in the country, and the reason why in and out of South Africa travel is so troublesome these days. Well, ladies and gentlemen, the world at large is waiting, and I mean patiently waiting for health experts in South Africa to tell us whether this will be causing any trouble for the rest of the world. And personally, I do think that these health experts should quicken their pace in determining whether this variant will be a problem. Some of us need to know whether or not to buy tickets for conscience, or should we just use that money to save and stockpile, you know? We need to know. Tell us.
And I'm so happy. The 31st of December, I will be in Kenya once again. I'm going to be at the Carnivore. Big up Energy Radio, big up B Mobile, big up Tusker. I can't believe it. I'm going to be there again one more time. Conscience representing to the fullest. Get your tickets now at M Tickets. Hear that? Don't miss it. December the 31st, Conscience, live in Kenya. It's going to be crazy. The heart of man changes every day, but the love of the Most High always remain the same. Seek not the approval of a man or a woman. Mankind they have today, tomorrow them gone. May God say Jah love me. Kenya.
The government of Kenya issued a directive late last month that any individual wishing to get any government services will need to show proof of vaccination. And ladies and gentlemen, it is so unfortunate that to this very day, only 5.4% of Kenyan population has actually been fully vaccinated. Ladies and gentlemen, I don't know what will get these people to be vaccinated. Doses are there. What is stopping you from sparing 30 minutes of your time to go into a vaccination center, which, by the way, is only a Google search away, your nearest vaccination center? You just Google your nearest vaccination center and it will show you. Of course, you will need to put location on, okay? Some of us just deny everything. Accept location? No. You don't even know what they are asking for. Whether it's you need to turn on your location for them to give you the nearest vaccination center, for crying out loud. But all in all, please, South Africans, tell us, will this be a problem, or should we just save the money we're about to buy conscience tickets with? Away from vaccines and over to grasshoppers. Yes, I said it right. Grasshoppers. So yeah, that's what I said. Grasshoppers. Or as your Ugandan friend might call them, nsenene. I hope I said it right, did I? Well, an enterprising Ugandan international was caught on Ugandan Airlines plane selling nsenene to fellow passengers. By the way, the airlines has since released a directive that they will be considering introduction of this nsenene in their menu, because it seemed from the video that indeed the passengers liked them. And this might surprise you, but this individual is facing actually a 7 years jail term, possible jail term, because it's still ongoing, for selling these grasshoppers. This individual, by the way, deals in electronics, so that is what was taking him to Dubai. The flight was from Entebbe to Dubai. He was going to Dubai for electronics. His work is not selling grasshoppers on flights, okay? That is just a by the way. Each handful of this nsenene was going for around $2.8, which is approximately 320 Kenyan shillings. So you can try and figure out how much this individual made if you at all he sold this nsenene to about 100 people on flight. Of course, not forgetting that he could and possibly did hike the prices for the people in first class. I mean, it's the reason they're in first class, okay? And lastly, on that story, what do you think happened to the money that he took? Because after returning back to Uganda, these two men were apprehended. What happens to the money that they got by selling these grasshoppers? Yeah? Will it be used, to cater for their bail?
The Tanzanian government has called for more people to take more COVID-19 precautionary measures as the Omicron variant continues to spread around the world. The new variant was first identified in South Africa and has since been reported in nearly 20 countries, including Botswana, Belgium, Hong Kong, and Israel. And with cases increasing, Tanzania's health ministry is warning that Tanzanians must be alert as the festive season is around the corner. Tanzania has recorded a total of 26,261 COVID-19 cases and 730 deaths since the outbreak of the pandemic in March last year. It is now calling for more citizens to be vaccinated.
The total number of those vaccinated is 1,520,275, which is 2.7% of all Tanzanians. Among those, 1,027,818 have completed the dosage. The aim of the government is to ensure we get to vaccinate 60% of the population vaccinated against COVID-19. Hence, government officials will continue educating people.
The government has also asked citizens to increase hand washing, use of sanitizers, exercising, and the use of natural remedies as advised by health professionals. It says it is testing all travelers at airport, ports, and at all border points, as well as monitoring other countries with a high number of cases. Daniel Kijo, SABC, Dar es Salaam.
Thank you so much for being with us. I know you were just treating other patients, so we appreciate you taking the time to speak to us, and we have very important questions for you. Namely, talk to us about the severity of the cases you are seeing. How sick are the patients you're seeing who do have this new variant?
Good evening or good afternoon, but at South Africa time it's now afternoon. So yeah, it's a very good question. So the public needs to understand what we currently are seeing. It's very early days, and it's now more or less, I call it day 13, which since, we have made the diagnosis of these variant new variant that's going around. So if you look at the severity, and especially in the beginning of any wave, it's normally not that severe. It's normally the younger people that gets infected. And then from there on, it will spread and go further. So hopefully we can keep the clinical picture as it is. If we say patients are not, they are moderate ill, they're not severely ill. I'm also part of a group of about 8 doctors, and only 2, some of my colleagues, only 2 patients that admitted the past 24 hours. I'm not sure about those patients' symptoms. But the majority of what we are presenting to primary healthcare practitioners are extremely mild cases, so mild to moderate. And so these patients means they don't need to be hospitalized for now. And we try to get the message out there to the world to say, listen, we're not saying this is not going to be a disease going forward that's going to cause severe disease. It will cause severe disease. But if we can get this disease, if this disease can cause to more than the majority of people mild symptoms, easily treatable at home, no need for admission. That's a first prize. But for us to tell this to the world, we need to tell you what the symptoms are so that the people can understand. If I feel a bit fatigued for a day or two, something, not the fatigue that you use. This is a different type of fatigue with a bit of a scratchy throat and a bit of a body ache and pain and with a headache. We call it normally malaise. So I don't feel generally well. Go and see your doctor. And then we need to tell the doctors, you're not going to see a very sick patient sitting in front of you. Test the patient. Mm-hmm. So if you can test and trace, and we can get the patients to understand that it's mild symptoms for now, but go and see a healthcare facility. Go and get yourself checked out. If you can get that message out to the world, it means that we would most probably going forward have less severe cases, less people going too late to the doctors. And that's that no system can afford that. Not South Africa, not the United States. No one can afford that.
Let me just reiterate, if I can, Doctor, if I just jump in here, just to reiterate one point here so people hear it clearly. Now, this could change. I understand it's the early stages, but right now, the patients you're seeing with this new variant, you're dealing with very mild to moderate symptoms. You are seeing no or very little severe disease, correct?
Yes.
Have you treated patients who have been vaccinated and now are coming in with the new variant? And what are you seeing there?
Same picture. Interesting enough, with the moderate, the mild, what we call mild, symptoms, that the patients that has been vaccinated so far, I have no complication. They are, it is as if it's, I don't want to use the word self-limiting, but minimum conservative measurements that they needed, and they feel fine. It seems to me it's about the first 2 days before they come and see the doctor. Then it's about another 3-4 days, and they're out of it. And so the nice thing is, if you pick it up, if you might make the diagnosis, and you take the patient out and get them to self-isolate and the rest of the family to quarantine, you will also spread less. But yes, I have seen vaccinated people and not really very sick. That might change going forward. As we say, this is early days.
No,
and this is maybe what makes us hopeful.
I do understand these are early stages, but I also think it's important that people know what you are seeing. You are seeing people who have been infected or vaccinated, and they're just not very sick, which is exactly what you hope for with the vaccine in general. We don't know over the next 2 weeks as these tests come back if maybe the Omicron will find ways to evade the vaccine, but as of now, it does seem to be offering some protection. That does seem to be key. So based on what you're telling me, with mild to moderate cases, with the vaccinated people who have it with very mild cases, what's your assessment of how the world has reacted to the news coming out of South Africa about the Omicron variant?
I think it was an overreaction. I do understand that there's a lot of mutation in this virus. I do understand that it might be much more fast spreading than the Delta variant. But if you look, I think what one needs to do, there's two types of, and people who are medical, in the medical field will maybe understand better what I'm trying to say here. So you get two types. You get the scientists, and we need the scientists, and it's important that we get the input from the scientists. But while the scientists wait and are busy doing their work in the background, unfortunately, the patient doesn't wait. The patient comes in. And you need to alert your doctors and say, listen, there's something happening. There's something going on. Look at it. See what you can do. So and then telling the world there's something out there, and then being slammed by getting these, we call it the knee-jerk reaction of closing borders and everyone, and people say, yes, but I'm trying to protect my people. So then the question would be, how do you know it's not in your country yet? How do you know that a lot of those infections that you are currently seeing that is severe, how do you know it's not maybe related to the Omicron? How do you know? And how do the doctors know if they're not aware that the patient sitting in front of them with a bit of a scratchy throat and said, I don't feel quite well, doctor, a bit of a flu, that's what they would normally call it. I'm not feel, but it's not too bad. And then the doctor would just prescribe some painkillers, not testing because they're not thinking that this might be Omicron. And I think if for South Africa to spread the message out there and then being slammed, that doesn't make sense because it's other people's lives as well. It's a huge impact. It's a huge impact on the economy of South Africa. It's a huge impact to the people that want to come and visit family. It's a huge impact from South Africans that want to go and visit family and friends during the festive season. I just think, there's other ways to do this.
And again, I want to reiterate, as you have many times, it's early and we still have much to learn. But the epidemiology, when we're talking about the history of pandemics or viruses, there has been a tendency for mutations toward the more mild. There have been viruses, and there's scientific reasons for it, why when they do mutate, they mutate to becoming more mild. And you say it's possible that if that's what's going to happen with Omicron, that it may contribute to herd immunity. How would that work?
Well, I would be happy if that would be the case, but only time will tell us. And hopefully that would, with this fast spreading of the virus, with people being vaccinated, hopefully this would be something that we can just pray for going forward. And it's not off the cards. It's not to say it's not going to happen. But again, the 30+ mutations are very worrisome to our scientists. Actually, they don't really want us to say that this is mild at this stage, but it is what we see. We cannot go out there and advise doctors and people and say, listen, wait for the symptoms to come. You need to know what the symptoms is while we wait to see how this virus is going to behave.
Fatigue, scratchy throat, look for them. Over the next 2 weeks, what's the biggest question you want answered?
I would like to see over the next 2 weeks, the biggest question would be, is it going to give us more severe disease? What is it going to do to the elderly that's unvaccinated or people with comorbidities unvaccinated? That would be interesting to see what it's going to do. And then the second thing that is important, we need the data to see how many vaccinated people got severe infections and breakthrough infections. And then the third last one would be how many people previously had COVID-19, whether it's beta or delta, and get reinfected. And then again, is it mild or is it moderate, or mild or severe to be admitted? From at a clinical perspective, for us, that is important. Does it really matter for me when a patient sits in front of me, whether he has got 30 mutations or not? I still need to treat him. Whether he's got 2 mutations, 30 mutations, I still need to make sure that I do what is in the best interest of this patient. So from a clinician's point of view, we need to understand what do we give, how do we treat, how do we pick it up, and what is the outcomes.
According to the regional virologist for the World Health Organization Africa, Dr. Nixie Gumed, the discovery of the new variant is a concern due to the age group of people being infected. Dr. Nixie said that there is a very high concern, meaning that it seems as if the majority of the people that are infected by this variant is quite an age group that is having a high possibility of really taking the virus all over it anytime. Some countries have already suspended flights with South Africa since Friday. Dr. Gumed believes this may discourage other nations from declaring cases in future. The discovery of a new and potentially more transmissible coronavirus variant by South African health authorities has sparked a lot of reaction across the world, causing a number of countries to ban travelers from several southern African countries. The World Health Organization announced Friday it has designated the newly identified coronavirus variant as a variant of concern named Omicron. Besides South Africa, the newly identified variant has been detected in Botswana, Hong Kong and Belgium.
Experts in South Africa say the surge in COVID-19 infections is the highest they've seen since the start of the pandemic. And they blame the latest and possibly most contagious variant, Omicron.
They warned us that the variants would generally be more transmissible, but most of the time they would be less severe. Today, as we enter the fourth wave with a new variant, we can see confirmation of this warning.
While people from this and other countries in southern Africa are facing international travel bans, lockdown restrictions in South Africa are at their lowest. The government is instead urging people to get vaccinated. So far, 42% of adults have received a jab.
With hospital admissions mainly dominated by those who are not vaccinated and young people below the age of 40, most of whom are not vaccinated. At this stage, we can say that even in Gauteng, which accounts for 72 to 80% of the new daily infections, we have not yet reached threatening stages in terms of our hospital capacity and the new hospital admissions.
The government says it has enough resources to deal with the outbreak, even in one of the worst hit provinces, Gauteng. The latest statistics show daily infections are growing, and health workers are also concerned about the high number of children under 5 years old who've been hospitalized.
The phenomenon of young children, younger age groups, as well as pregnant women having increased infection is currently being investigated. We are hoping that in the coming weeks, we'll be able to also give reasons for why this particular cohort of patient is having increased infection.
But officials hope that while the new variant appears highly transmissible, it can be managed. The government says it will continue door-to-door campaigns and community awareness programs to try to convince people to get a jab. Health experts say the number of people dying from COVID-19 has remained low because of vaccinations. And right now, 1 in 4 people tested for COVID-19 in South Africa are recording positive. Famida Miller, Al Jazeera, Johannesburg.
Another wake-up call. We should all be wide awake to the threat of this virus.
Omicron has now been detected in at least 24 countries around the world, according to the World Health Organization, WHO.
We don't yet know whether Omicron is associated with more transmission, more severe disease, more risk of reinfections, or more risk of evading vaccines.
South Africa was the first country to detect the highly mutated new variant. Its National Institute for Communicable Diseases, NICD, has said more than 70% of all the various genomes it sequenced last month have been of the new variant.
We should all be wide awake to the threat of this virus. But Omicron's very emergence is another reminder that although many of us might think we're done with COVID-19, it's not done with us.
India, Ghana, Saudi Arabia and the United Arab Emirates are among the latest countries to have confirmed their first cases of Omicron. Others, including the UK, US and Germany, have also seen people infected by the new variant. Many questions about Omicron remain to be answered, including how much protection the current vaccines provide. The World Health Organization has categorized it as a variant of concern and says early evidence suggests it has a higher reinfection risk. Earlier this week, countries around the world restricted travel from Southern Africa as details of the spread emerged. This prompted South Africa's foreign ministry to complain that it was being punished instead of applauded for discovering Omicron. South Africa's President Cyril Ramaphosa also said he was deeply disappointed by the travel bans, which he described as being unjustified.
We are deeply disappointed by the decision of several countries to prohibit travel from a number of Southern African countries, including our own.
The new infections are driving what is now the beginning of a fourth wave of coronavirus in South Africa, and the National Health Department says there has also been a slight increase in hospital admissions.
Stories coming through from across the world.
Fears mounted that a highly infectious new coronavirus strain was pushing its way into Europe as the world brought the shutters down to contain the new Omicron variant. Suspected new cases emerged in Germany and the Czech Republic, while Dutch authorities quarantined 61 passengers from South Africa who tested positive for COVID-19. South Africa complained that it was being punished with air travel bans for fast detecting the strain, which the World Health Organization has termed a variant of concern. Australia and Thailand joined the United States, Brazil, Canada and a host of other countries around the world restricting travel from the region, fearing a major setback to global efforts against the pandemic. Scientists are racing to determine the threat posed by the heavily mutated strain, which is more transmissible than the dominant Delta variant, and whether it can evade existing vaccines. Anxious travelers thronged Johannesburg International Airport, desperate to squeeze into the last flights to countries that had imposed sudden travel bans. Many had cut back holidays and rushed back from South African safaris and vineyards. Elsewhere on Monday, nearly a quarter of a century on, Prince Charles will be present when Barbados becomes the world's newest republic with an elected president, not the Queen as the head of state. The ceremony will not be on the same scale as in Hong Kong, when military marching bands and bagpipes provided the backdrop to a momentous occasion that was described as the epilogue of empire. But the Caribbean islands' abandonment of constitutional monarchy is important not just for the monarch and her heir, but the new republic and others that may follow. Royal officials have said little about the end of nearly 4 painful centuries of British rule and influence on Barbados, which was a key centre in the slave trade. However, it sends a clear message that in the twilight of the 95-year-old Queen's reign and when Charles, aged 73, succeeds, the British monarchy's global reach is diminished.
If they do not appreciate the travails of those who went before.
And finally, police in Burkina Faso fired tear gas to disperse hundreds of protesters at an unsanctioned anti-government rally in the capital on Saturday, an AFP journalist reported. Anti-riot police fired tear gas to prevent the demonstrators from gathering for the rally in a square in the center of Ouagadougou, where substantial police and security forces had been deployed and all shops closed. Angry young people erected makeshift barricades and burned tires in several neighborhoods in an effort to block police movement. The crowds had wanted to demonstrate against the failure of the president to quell jihadist violence that had engulfed the country, but city authorities banned the gathering. One of the protesters, 28-year-old Fabrice Sawadogo, said that after 7 years of failure to prevent the terrorist attacks, it is time to ask the government to go. The incompetent administration has to admit it has failed, he said. An alliance of 3 groups called the November 27th Coalition had called for people to take to the streets on Saturday in a peaceful atmosphere to denounce the growing insecurity and demand of departure of Kabul. A spokesperson for the group, Mausa Konate, said that it was also planning to hold protests in the nation's second city and other cities. But other civil society groups distanced themselves from the protests, refusing, they said, to be complicit with those who want to push the country into chaos. Groups linked to Al-Qaeda and the so-called Islamic State group have plagued the landlocked Sahel nation since 2015, killing about 2,000 people and displacing 1.4 million from their homes.
Dr. Fauci say just recently that the booster shots raise the level of protection. But as we heard in Stephanie's piece just there, one of the cases in Minnesota, that 30-year-old man who attended that anime convention in New York City, is fully vaccinated and received a booster. So, bottom line, do booster shots protect us from these new variants?
Good morning, Kira. And we still have enough evidence, if not anecdotal, but based on previous science, to suggest that boosters still work. Remember, this one person who went to the convention, he tested positive, had mild symptoms. Could it have been worse if he wasn't boosted? It's possible. Also, we have to think about the thousands of other people who may have come in contact who were boosted, who aren't being reported right now because they're either asymptomatic or they have not gotten tested positive. So it's really hard to make these widespread speculations just based off one case. We still have enough evidence to tell people to go out and get boosted.
Right. Okay. And it's still unclear if the Omicron variant will be any more severe, because a lot of scientists are coming forward saying although it's more infectious, it looks less likely to lead to severe symptoms, as you just mentioned, and also hospitalizations. And now Mayor de Blasio there in New York just announced this vaccine mandate for all private employers to combat the spread. So how should leaders across the country, you think, react as these new variants continue to emerge?
Well, I think, we have to look at this in two different parts right now. So the first thing is that leaders need to be not only protecting people, protecting their communities, but we're also trying to prevent another surge in hospitalizations in an already strained healthcare system, which, even mild to moderate cases can do that, especially if people are missing work, they have to go to doctor's offices and so forth. But Kira, here's what's kind of counterintuitive. It is not advantageous for the virus to be more virulent or kill more people, to put it bluntly. The virus wants to be more contagious because it wants to outcompete Delta, the Omicron variant. But if people are getting really sick and they're not spreading it, the virus doesn't want that scenario. And so, the way to think about this is that what the virus wants to do to be able to kind of propagate and survive is infect a lot of people, but kind of tone it down a little bit so that more people can pass it on, if that makes any sense. So right now, the early data is encouraging, but we need to see more.
Right. And what's your opinion on the effectiveness of these travel bans? There's been some outcry over the U.S. ban on certain African countries in response to this variant, including bans on some southern African countries where the variant has yet to even be detected.
I and my colleagues are a little confused about the travel bans because if you look at the amount of cases in South Africa and those surrounding countries, they're not astronomically higher than what we're seeing in the European Union. And there's no travel ban in effect in Europe. So when posed with this question of where is the evidence behind a travel ban, all we keep hearing from the White House and coronavirus task force is we're waiting to reevaluate them. We're waiting to see what the data shows. But that doesn't sit well with a lot of people because we want to exactly see why is this travel ban in effect and a good thing, and why is it not travel apartheid, which is what the World Health Organization called it. So I think it would build a lot more trust if we were transparent about why these travel bans are in effect to begin with.
All right, if you don't mind switching gears just a bit quickly, this new study by researchers at the Cleveland Clinic reporting that blood pressure spikes in adults during this pandemic, even more so in women than in men. Why are we seeing this increase, and what should people know about treatment and screening?
Well, Kira, I would never mind talking about preventative health because that is what this boils down to. So this study actually showed a small increase in blood pressure. If you look at the beginning of the pandemic in spring 2020 versus 2019, the important things to look at is there's a lot of factors that can raise blood pressure. Things like a sedentary lifestyle, stress, poor diet, alcohol, smoking, a lot of things which may have increased in certain populations in the United States during the pandemic. But also we have to consider blood pressure wasn't well controlled going into the pandemic. So you give people a barrier of access to healthcare, less preventative health services, and those blood pressure numbers are going to go up. And hypertension, defined as 130/80, can be a risk factor for a lot of diseases, kidney disease, heart disease, stroke, and so forth. So I'm hoping this is a little bit of a wake-up call for people to not only get into healthcare, but for people to be better about screening and lifestyle changes where needed.
Yeah, very good advice. And bring on the meditation. Dr. Patel, always good to see.
The spike protein of this variant contains mutations already known to increase transmissibility of the virus. But there are additional changes that may mean antibodies induced by the vaccines or by infection with other variants may be less effective at preventing infection with Omicron. Until we know more, we should be cautious and take steps to slow down the spread of this new variant. But as we have seen before, reduced protection against infection and mild disease does not necessarily mean reduced protection against severe disease and death. Every time a new variant arises, vaccine developers have started work on a new version of the vaccine, and the same is true for Omicron. The work starts straight away, at risk, without waiting to find out if a change will be needed. But this may not be needed. Getting vaccinated now and getting boosted is still the best way to protect ourselves. Vaccines are still the way out.
Health officials on Sunday said the Omicron variant of the coronavirus has spread to about 1/3 of U.S. states.
Well, the winter plan that the president announced actually had a number of strong measures.
But U.S. Surgeon General Vivek Murthy sought to reassure the public that the Biden administration was prepared to confront the newest mutation of a global disease.
The president announced were much stronger measures to expand our booster campaign. We're going to have millions of reminders sent out to seniors, many more appointments set up by pharmacies and hundreds of family clinics so kids and adults can get vaccinated together. There was also an expansion of testing, 50 million free tests that will be sent out, private insurance coverage for tests starting in January.
And speaking on CNN, top U.S. infectious diseases expert Dr. Anthony Fauci reassured that when it comes to Omicron, quote, thus far it does not look like there's a great degree of severity to it. But he added that it was too early to draw definitive conclusions and that more study is needed.
It's too early to say that.
Former FDA Commissioner Scott Gottlieb agreed it was too early to say how dangerous Omicron may be, in part because most of the data out of South Africa is from Omicron cases in people who already survived the Delta variant.
We don't know whether or not this new strain is inherently less virulent, so it's a more moderate strain of COVID. It's not causing as severe illness, or whether it's presenting that way simply because it's infecting people who already have some pre-existing immunity, so they have some protection from COVID, so they're getting infected, but they're not getting as sick.
Many of the cases in the U.S. so far were among fully vaccinated individuals with mild symptoms, although the booster shot status of some patients was not reported. According to a Reuters tally, the U.S. over the last 7 days has averaged 119,000 new coronavirus cases a day. Over that same period, the virus has killed almost 1,300 people per day.